With the advent of stem cell transplantation, the previously uncurable set of diseases known as haemoglobinopathies became curable. Decades on, we now face an exciting new future with the application of gene therapy to this area. To discuss this, I'm joined by Josu de la Fuente, Secretary of the Hemoglobinopathies Working Party, nurse representative Sandrine Bramantas, as well as the Severe Aplastic Anemia Working Party's nurse representative Kelly Hennessy. Thank you all for being with us today.
Thank you.
Thank you.
Josu, let me first come to you. Could you tell us, what do we mean by hemoglobinopathies and how has treatment progressed over the last 40 years?
Hemoglobinopathies refers to disorders where there is inadequate hemoglobin production that leads to lack of adequate oxygenation to the organs, and that leads to substantial organ damage over time. They are classified, broadly speaking, in two groups, thalassemia and sickle cell disease. And over the last 40 years, we have seen a substantial reduction in mortality in early life, particularly in the pediatric and adolescent years. However, we have had little impact onto the morbidity as patients go into the 20s to 40 years of age. And the overall survival is still significantly affected in comparison to the general population.
Sandrine, maybe I could come to you. Josu has just given us a resume of the last 40 years, but what does treatment look like for patients today?
So treatment today, for our patients with sickle cell disease, the standard of care is to remain using the use of hydroxycarbamide. Hydroxycarbamide is a medication that is used to prevent end organ damage. And we monitor the disease progression by using transcranial Doppler scans and then determine whether the need for red blood cell transfusions or other treatment plans. Patients with transfusion-dependent thalassemia will have regular blood transfusions, and the key part for them is the iron chelation treatment that they need, and also the regular monitoring of the iron overload by using MRI scans.
Josu, how effective is haploidentical HSCT for these patients, and how are you working to improve it?
There are two techniques currently, one based on post-transplantation cyclophosphamide and the other one on graft manipulation with alpha-beta depletion. Both are reaching levels of optimization to ensure good engraftment and minimizing graft-versus disease to the point that we are very close to obtaining the same outcomes as in sibling transplantation.
Kelly, let me bring you in. How promising are gene therapies for hemoglobinopathies, and what's the state of the approach at the moment?
Yeah, so gene therapy is extremely promising for hemoglobinopathies. I'm the lead research nurse for gene therapy in our trust for the age of 5 to 12-year-olds, and we know from the age of 12 to up to 35-year-olds that it has been approved by regulatory bodies. So I think for those who don't have a fully matched HLA donor, that gene therapy is hopefully the way forward for this group of patients.
And what are you seeing with patients that are coming back to the clinic after a couple of years?
So we run the Followup clinic in Imperial College for those patients, and the patients are now at least 2 years post-transplantation. They were able to return back to work after 3 to 6 months post-transplant, so a lot sooner than a standard transplant patient. It has been life-changing for them, and they are all big advocates of gene therapy and the positive impact that it has had on them to date.
That must be very rewarding to see that.
Oh, it is. It is great to see them to come back into clinic and to see how well that they're all doing.
And Josu, let me pick up as well about how excited you are on these new therapies.
It's life-changing to think that having started my career where barely transplantation was possible for them, we are in a situation that any patient who warrants it and can run the risks of having a procedure, whether it's going to be high-dose chemotherapy, can actually access it regardless of the status of the donor. So I can see a future where all patients will be able to achieve a definitive cure rather than to continue treatment on a daily basis.
And let me just pick up on that point, Kelly and Sandrine, with you. What do you see for the future, and how hopeful are you that people can be effectively cured?
Yeah, so I do hope that this is the way forward for all our families, especially those who don't have a suitable donor and who we meet in clinic on a regular basis. I think that this will be life-changing for all of them and will have such an impact on especially our paediatric population as we see them go into adulthood.
Just to finish in one sentence, Josu, how optimistic do you feel for them, for patients being diagnosed today, compared to the past?
So these patients are identified with the newborn screening program at birth, and so they grow from the very first understanding of the surroundings, knowing that they have these disorders. They can see themselves in comparison to their peers and siblings, family members, and so to suddenly realize that they are going to be able to change that and not find any differences between them and the rest of the world around them must be very, very encouraging. We don't know yet at this point whether we should be able to offer it immediately to everyone due to the complexity and cost of these therapies. But I think as we advance in the coming future, these treatments will become with wider availability, and one can see the future where everybody will be treated with a definitive cure.
Thank you all for joining us, and every success with the Working Party.
Thank you.
Thank you.